I was reading about an interesting study that correlated symptoms with IBS as well as fibromyalgia, and on the face of it you might not think there's any relationship between those two, but it turns out that there is. Over 50% of people suffering with IBS, which is Irritable Bowel Syndrome, over 50% of them have fibromyalgia symptoms. If you haven't heard of fibromyalgia, it's basically pains and aches in muscles and joints throughout the body. It can ebb and flow. A lot of times patients are fatigued. They have brain fog, and it's more prevalent in women, which most autoimmune diseases are, unfortunately for women. But what is the relationship? 70% of patients with fibromyalgia have IBS symptoms. So what should that tell us? That should tell us that there is a gut relationship to these pains and aches that people are suffering. So when someone is given the diagnosis, and by the way, if you're given the diagnosis of IBS, there's 10 to 15% of the population estimated to have it, but only half are diagnosed. Fibromyalgia, smaller percentage, 2 to 4% of the population. But again, with fibromyalgia, 70% have symptoms of IBS. Now, irritable bowel syndrome can include mostly constipation, it can be mostly diarrhea, or it can be mixed where you're going back and forth. But with both conditions, basically you're told you have to manage it, meaning there is no cure, there is no resolution. And I'm certainly not saying that here at Root Cause we resolve 100% of cases, we don't. But we do have a very high percentage of resolution with IBS and a decent percentage, not the 85% with IBS, but definitely a strong percentage of resolution with fibromyalgia, depending on how long somebody's had it. So what we want to look at is the fact that why is a strong correlation between the two? It's because your gut houses your immune system, and with fibromyalgia being an autoimmune disease, whereas 70% of the immune system housed in the gut, and that is correlated by this symptomatic relationship with the IBS, where 70% of these mostly women who suffer from all this joint pain and fatigue and brain fog, they have IBS-like symptoms as well. So we want to look to the gut. When you look online and you look at various research, there's a whole slew of recommendations that are put forth to manage the gut symptoms. And it's eat more fiber, which is great because that means it's fruits and vegetables, fresh fruits and vegetables, which are great for balancing out gut health. They tend to be anti-inflammatory, so that's definitely a pro. But then you can be told to follow a low FODMAP diet. Now, the low FODMAP diet has some fruits and vegetables, but it also gets rid of a lot of them. But it's temporary, so you can definitely try a low FODMAP diet. It's for about 2 weeks, and if it makes a huge change, great. This is not designed for your lifetime. It's just to sort of settle your gut down, and then you do a gradual reintroduction. And then there's probiotics and not probiotics, meaning that sometimes taking probiotics can really help balance out more of the good guys in your gut, but other times certain probiotics are feeding a real irritant in your gut, and you're going to get symptoms that are worse. And I'm not trying to confuse you. I'm trying to give you the span of information that we've seen. So one thing that's not mentioned enough in the literature is the association, unless they're doing the actual research on gluten, is the association with gluten and IBS and gluten and autoimmune diseases, because that correlation is very high. So you definitely want to get a good solid test, not just for celiac disease, but for non-celiac gluten sensitivity. I love a test called the Wheat Zoomer. That's its name, Zoomer. And what I like about it is just a finger prick, so you don't need a venous blood, and you can see a nice broad spectrum of how you react to gluten, from celiac tendencies all the way through gluten sensitivity. Does it bother you more neurologically? Is it more skin relationship? Is it more gut relationship, or some combination? It's really a great test. You're going to have to go through a doctor. We're happy to help you, but it really is a great test. And then certainly the dietary measures were important, the gut-brain connection. So Those who have a stress relationship between stress goes up and the gut gets very upset, you want to look at the adrenal hormones, the stress hormones, the thyroid hormones, the sex hormones, and we like to work with those very naturally with either bioidentical hormones or various herbs that will balance. So it really depends on the individual. We do testing to see the direction that we should go. But I think the biggest miss in a lot of the research that I saw was not appreciating the gut microorganisms of not just the good guys but the bad guys. So what was kind of the miss that I saw was stool analysis, comprehensive stool analysis. I'm not talking about the type of stool analysis that your medical doctor will do that looks for a couple of acute parasites, blood in your stool of that could indicate cancer. It's a very narrow test. There's nothing wrong with it, but it's not nearly the comprehensive stool analysis that's looking for a variety of microbes, parasites, bacteria, fungi, protozoa that really can be creating a lot of inflammation in the gut. So the takeaway from this is that there is a relationship between IBS and fibromyalgia. The gut plays a big role in all autoimmune disease because, again, 70% of your immune system is housed in the gut. And I think that for those of you suffering with either of these conditions, try to find a practitioner who has resolved these in the past, and it's not just about managing them. Of course, if that's the best you can do, that's the best you can do. But we've had such good success in really resolving IBS and fibromyalgia, and they're both pretty miserable. You're in pain all the time with fibromyalgia, and then with IBS, you're kind of tied to a bathroom. You have abdominal pain. Your gut is kind of ruling your life in a very negative way, which is very unfortunate. So if you're suffering from either of these conditions or you know somebody is, please have them reach out to us. We'd love to help. If you enjoy this kind of information, please give us a thumbs up and subscribe to the channel. And if you do want to take advantage of a free phone consultation, we are treating via telemedicine across most states in the country, and we'd be delighted to help. So just contact us via the website rootcausemedicalclinics.com or give us a call 408-733-0400.